Good afternoon. I'm Jessie Higgins. I'm the Chief Mental Health Officer with the City of San Antonio. I'm so happy to be here today with you to bring you this presentation on youth mental health. It's no surprise to me that everyone's here today. I know this is a really, really important topic that everyone wants to pay close attention to, and I thank you for your time and sharing it with us. Before we get started, a few housekeeping items. If you're attending the conference to receive CEUs, this would be for LPCs, LMFTs, social workers, and psychologists. Please listen carefully to this. If you're not for CEUs, just take a little mental break. So you need to remain in the session for the entire time, not if there's like an emergency, you're allowed to. Please have signed in the back with the proctor, and at the end you'll need an evaluation form, or you'll get that, you should have that already. And then at the end, you will turn that back in, you'll sign, and you'll get your CEUs. This session is about 75 minutes long, we'll go till 1:15, and you'll receive 1.25 hours of CEUs. You can get a total of 3.75 CEUs for attending the 3 workshops today. Okay, everyone tune back in if you were not listening because I was talking about CEUs. We're grateful to have the support of NAMI Texas and the Bexar County Recast Project. And all registered this is still about CEUs. Gotta stay here the whole time, turn in your evaluation form and you'll get that. Now it's my pleasure to introduce our speakers. Our first speaker that I'd like to introduce to you, her name is Gloria Hulshof. She graduated from Our Lady of the Lake University with her master's degree in social work and received her social work license from the state in 2006. She is currently a school social worker for San Antonio ISD, where she has worked with students and families for 12 years. I want to highlight, this is the end of Gloria's second week back at school. We need to give her an extra round of applause. Next, we have Meredith Howe. She's the Senior Management Coordinator with the City of San Antonio Metro Health Department's Project Worth program. Meredith has served the local health department for 7 years and has a passion for public health promotion and education in the local community, especially among youth. Meredith is also a certified health education specialist and holds a bachelor in science and public health with an emphasis in health promotion and in behavioral science from UTSA and a master of science in health studies from Texas Women's University. Meredith enjoys visiting local and state parks to connect with nature and be active and spending time with family and friends. We have a bonus presenter who's not in our program, but we thought it was really important to include Michael Valdez. He's a recent graduate of Edgewood Fine Arts Academy and entering his freshman year at San Antonio College, also beginning of school for Michael. He is currently employed with Metro Health as a Project Worth Teen Ambassador's mentor. Michael previously served dual membership as a teen ambassador and the chair of the San Antonio Youth Commission, and in these roles was highly involved in development and dissemination of the Teen Mental Health Survey, which we'll be hearing about in a little bit. And last but not least, we have Spitsen. She has over 20 years of experience working in the public health sector, addressing communicable and chronic diseases through programmatic policy and system changes. In her role as Community Health Program Manager with the San Antonio Metro Health Department, she is responsible for the oral health program, a fluoride and sealant-based program for children, and Project Worth, a teen health program. Ellen earned a bachelor's degree from Western Washington University and is originally from Seattle, Washington. So I'll turn it over to our speakers, and we hope you enjoy our presentation.
Welcome. I need to practice my microphone voice for a second. So, welcome everybody. I hope you're excited to be here. We are very excited to talk about the impact of COVID that it has had on our teen mental health. So what we want to do, I want to give you a run through of what the next hour or so will look like, with the star of our show being the mental health survey that was completed. But before we get to that, can everybody hear me? I just want to make sure. Okay. Before we get to that, I want to just talk about trauma for a little bit. How would you guys describe trauma? Who wants to take a poke at it? What is trauma?
A drastic change in your life.
A drastic change in your life. What else? Is it something that is positive?
No.
No. What's something negative that could be considered traumatic?
A loss.
A loss? The death? Or
Divorce.
divorce?
Abuse.
Abuse. Yeah. So, in other words, it's an event or a series of events that people can perceive as a threat to them. Sorry. So, a series of an event that people experience as something threatening, which then leads to a biological reaction in our brain. This isn't something we always talk about, right? When we're saying that was traumatic for me, or that kiddo had something very traumatic happen to them. We're really talking about the event, but we're not really talking about the reaction that our brain has, what's going on inside our body. We might know it's happening, but in our everyday conversations, we're not talking about this piece, and it's important. So, this is how I kind of always explain quickly, a quick visual of trauma to students, to parents, to professionals, because I think it's helpful and maybe they take it away and they think about it later on. If everybody will raise their hand and cross their thumb over their palm. I promise this is not the Hunger Games. And go ahead and fold those fingers over your thumb. Imagine this is your brain. And if you are a neurologist, forgive me, this is very simplified. I use this as a quick visual. So our brain, it has two big parts, right? Our upstairs brain and our downstairs brain. Our upstairs brain is what develops as we develop, right? This is where we figure out, if I do this, there's a consequence. Our downstairs brain is what is wired pretty much from when we're born. This is where our body is told how to breathe, how to eat, how to sleep. We feel emotions here. And in the middle of this downstairs brain is the amygdala. Forgive me, I'm not a neurologist. This is the command center, right? This command center is constantly assessing the situation for dangers. So put that to the side for a moment, right? Enter COVID-19. When I say COVID-19, what words pop into your head? Death. What else? Isolation. Lack of toilet paper, shortage of meat. Lack of social support.
Zoom.
Yeah. Zoom, oh my gosh, survival mode for sure, right? So now, imagine, here's your brain, and COVID hits. Our amygdala starts going off. Hey, there's no toilet paper. Hey, I don't know if I'm gonna be able to get meat. Hey, my mom is sick, my grandma's sick. It starts going off, right? It starts activating. Luckily, we're all adults, right? So our upstairs brain has had time to develop. And it's telling us, hey, hang in there. We're gonna get through this. Go for a walk, reach out to a friend. We have ways to cope with that. But imagine you're a teenager and this part of your brain isn't fully developed. And now there's no toilet paper. I'm seeing it on the news. I can't talk to my friends. There's abuse going on in my home and I'm stuck here. This part of their brain has been constantly activated for the past 3 years, while this part of the brain hasn't been able to develop like it should have been. And that's why I think this survey is so valuable, because it is hearing from our teens about how it's felt, while this part of their brain, this muscle, got a huge workout over the past 3 years. And it speaks to exactly what they're going through. So I'm going to pass it over to Meredith.
Hello, everybody. Can you hear me? So we'll dive into the Teen Mental Health Survey. So if you have not heard about the Teen Mental Health Survey, this was a citywide survey that was released earlier this year. to better understand the impacts of COVID-19, but mental health among teens in San Antonio. This survey was created for youth, by youth. The youth that created this survey are members of the San Antonio Youth Commission and the Project 14 Ambassador Group. Both of these youth groups are part of the City of San Antonio. San Antonio Youth Commission is part of the Department of Human Services and consists of 22 high school students that represent the city council districts and are appointed by the mayor and city council members. And then the Project 14 ambassadors are 7th to 12th grade students around San Antonio, not from any specific school district or city council district, but they're teens that are interested in supporting teen health and by volunteering in the community and sharing their voices, creativity, and ideas on various projects such as this. So I'm going to pass it for a moment to Michael to kind of talk about his experience as a youth commission member and a teen ambassador in the creation of this survey.
Hello, my name is Michael Valdez. I served on the San Antonio Youth Commission. My term was over when I enrolled in college, and I'm also a Project 14 ambassador. Back in 2019, we met San Antonio Youth Commission met, and we wanted to see what our focus was for the year. So some of the ideas that came up were what our peers are doing and substance abuse, and it was during the COVID-19 pandemic, so a lot of us were at home and we wanted to gather more information on how the youth is doing during the pandemic. So we wanted to address our community, and we recommended for the city to create a survey for teen mental health and gather information. Being a dual member in the Project 14 Ambassador Program and the San Antonio Youth Commission, we brought both these programs together to develop this survey.
So additionally, in October of 2021, there was a release of the declaration that mental health among youth was a crisis. With the two groups coming together, they started meeting in around November, December 2021. This is a picture of them meeting at the Las Palmas Library. They had several group sessions. Michael helped coordinate some work groups over Zoom during the Christmas break, so this was on their own time between our normal set meetings. They were really committed to creating a very robust survey. They did working groups to develop questions for middle school, high school, and out-of-school time youth between the ages of 12 to 19. And then we came back together in January, and the youth worked together to kind of just narrow down the questions, and they developed a survey of 34 questions. This was then reviewed by some of the adult practitioners working with the youth for both Department of Human Services and Project Work. And as well, we partnered with UT Teen Health and their licensed professional counselor to review for medical accuracy, health literacy, and sensitivity of the questions, because that is something that the youth themselves were very concerned about. They wanted to make sure it was inclusive and sensitive to other youth that may be taking the survey and their experiences.
You might want to make sure your mic is working.
Can y'all hear me?
You just gotta project it to the
Okay.
microphone, Meredith.
Okay.
You can do it.
Thank you. All right, so here we are. On March 8th, the survey was released. We held a joint press conference at City Hall that Michael spoke at, along with our city manager and representatives from the Department of Human Services and Metro Health. The survey was open between March 8th and April 11th of this year, and during that time, the Youth Commission members and the teen ambassadors went out into the community and did like grassroots outreach to other youth. We have a couple pictures up here demonstrating that. National Public Health Week at Mission Marquee, as well as Ciclovia, where both groups came together and disseminated the survey, as well as at their schools. They did a lot of advocacy as well. With the survey, it was online based, released through the City of San Antonio's SA Speak Up platform, which is a the public input website. There's many surveys released through this website year-round, but this was the first ever youth-centered survey created by youth through this platform. So that was a really big deal for the city to do and support. In addition to that, among the 34 questions that were developed, there were 4 measures that kind of rose to the top that we were looking at with the survey, including mental health status, mental health issues experienced, who is used for mental health help or their support, and what affects teen mental health overall.
So I'm going to walk you through a little bit about the results of this survey. There's a QR code up here that will show up again, but the purpose of this is if you want to see the full report and even the survey, this is a good link to do that, and like I said, this will show up again. And so just a reminder again, as far as about this survey, the survey data we collected, it was not designed to be thoroughly disaggregated or formally analyzed. So what I am going to share with you is categorically the information that we received. This is the first year that we have conducted this kind of response and survey. So there's 3 key messages that I really want to walk you through as far as the responses. The response about what the youth were saying as far as their mental health status, the mental health issues they were experiencing, and the sources of help and stressors for them.
Ellen, real quick, I just want to, is this the same QR code here?
No.
Okay, so we'll put this slide up. I see everyone with phones. We'll put
It'll
this
show
slide
up
up at the
again.
end.
Well, it does, the QR code shows up again.
Okay.
So this is not your only chance, don't worry. Okay, so again, this was a really big deal to utilize the city's SA Speak Up platform for youth specifically. That has never been done. And so this was a survey that was released during spring break, right? Maybe that's not the ideal time that you would think to capture youth, but what we did receive was over 6,000 views. And this list here really kind of identifies some of the domains that led youth to the SA Speak Up survey. Total, we had over 1,000 survey responses were collected, and 846 survey responses were validated. So that's kind of like our N that we were looking at. And so then again, you know, you can see that these kind of came through a lot of different places, but nothing necessarily really typical, not a whole lot of social media that actually came through. So a little bit about kind of the representation in these responses. We did receive a pretty equal amount of responses for all 10 city council districts. For high school level, it was predominantly, they were high school or dual enrolled students that responded. And predominantly the responses identified as Hispanic. We had a 64% respondents that were Hispanic, followed by 18% that identified as white. So in regards to gender, 56% of the respondents identified as girl or woman. And this category by nature, just through the question, received 171 gender diverse selections. So all the survey results were disaggregated to better understand how each subpopulation has been impacted by the pandemic. And I'll be communicating that as we go through these responses more. .840 respondents of this question for the sexual orientation, and while predominantly the respondents identified as straight, we had a pretty good significant category of about 327 who responded as LGBTQ+ or sexual orientation as something undefined. So to better understand how this impacted this population, again, this was disaggregated as a subpopulation. And so overall, we had about 33 that identified as LGBTQ+ in this survey. All right, so let's talk a little bit about kind of some of the top mental health symptoms that were identified by teens. So eating or sleeping too much or too little, having low or no energy, not interested in spending time with people or doing usual activities, feeling unusually confused, forgetful, angry, worried, or scared, and feeling numb or nothing matters. As far as mental health issues experienced, 37% identified an inability to perform day-to-day tasks, and 49% identified feeling helpless, numb, or like nothing matters. And 24% communicated that they had started smoking, vaping, or using drugs. And again, here's that barcode again. You need to scan through this. So when asked really about a variety of depressive traits, females reported higher struggles compared to male participants, while the LGBTQ+ and the gender diverse youth reported 20 points higher on average than heterosexual respondents when reporting the inability to perform day-to-day tasks and feeling helpless, numb, or like nothing mattered. So 1/3 of the respondents identified suicidal ideation and thoughts or feelings about ending one's own life, as well as 1/3 identified hurting oneself, like cutting themselves, pulling hair, burning skin. And again, when disaggregated and really looking at the LGBTQ+ and gender diverse subpopulation, they reported higher rates of suicidal ideations and self-harm compared to the other subpopulations in comparison. So, who would you most likely go to first if you were struggling with a mental health issue? So youth predominantly reported having, like, they would go to their friend, right? And so then when you think about them going to their friend, who also, they may be struggling as well, and how does a friend kind of deal with some of that? And youth as well reported a lack of adults to talk with regarding their mental health. So as youth reported talking with their friends about mental health issues, a significant amount of youth also reported that they felt that they had no one safe to talk to. And as far as contributors of the top mental health stressors, school kind of reigned over all of that as the top mental health stressor. When asked about that, 59% reported school having a negative impact on their mental health compared to 51% stating COVID-19. Students frequently cited standardized tests and active shooter drills as times where stress increased. And as our previous results have shown, these results are even worse for the LGBTQ+ and the gender diverse. So as far as knowing where to go when needing help, predominantly youth did not know where to go when needing help and responded that the school did not have adequate support for mental health. So this is just a little bit of a narrative as far as some of the quotes that youth provided within this survey. So sometimes people don't talk about their problems because they don't know where to go or who to talk to. So knowing where to go to can definitely make an impact, especially if that place is free because we don't have money to see a counselor. So these are just really some of the significant ones that we just laid out on this slide for you to look at. So lastly, I'm going to close kind of that high level of survey results with you from a member of our San Antonio Youth Commission. I think this is a really powerful quote that she said, and it literally makes me cry every time, so forgive me as I read it. But it says, "This is not just proof of a problem, it's a cry for help. For me, this is more than just thinking about a problem, it's preventing it from happening to people ever again." Who are we to look at this need and not do anything for them? That's pretty powerful from a youth. So I'm going to pass this back to Meredith to talk more about what we are doing.
All right. So, that's a lot of heavy things there that the youth brought up in our community. But there was some really good recommendations made out of it and discussions that have happened since with youth and community members, and a lot of interest from the community. But the top 3 recommendations that the youth themselves brought up coming out of this survey included increasing in-school resources with access to mental health professionals, the creation of more mental health programs or programs that support mental health, and then increasing awareness of and access to confidential text services. So this is a bit of a deeper dive into each one of those recommendations with some input and suggestions from the youth, very specific suggestions. There's a lot of text up there, so I'll try to summarize it. Increasing the number of mobile wellness clinics at schools was one recommendation encompassed in providing more access at schools, including emotional support animals. There is a big desire for that. You'll see up on the screen, it says the emotional support animals will allow more young people to visit and connect with services available without feeling the stigma of going to a counseling center. So creates that connection and makes them, feel better, but it's not like they're walking in to talk to a counselor and it's very obvious, right? I'm just gonna go hang out with an animal and cuddle an animal can help them feel better. He also mentioned calming stations at schools for high stress times, such as during testing, somewhere they can go and just relax and decompress. Additionally, improving awareness about available resources. So some of the youth on the Youth Commission and the Teen Ambassador Group in their discussions coming out of the survey mentioned some of the schools have crisis lines on the IDs that they can access, but they also wanted things beyond crisis numbers, right? Because we're not always in crisis. We don't feel like we're in crisis. But there might be a need for other resources, free, local, and easy to navigate resources. And the continuation of kind of in-school resources included peer-to-peer support training for youth, including crisis intervention training for youth, so that they can kind of have that training and be equipped when their friends come to them on what to do next and how to support them, their friends and themselves. And they felt like this could help decrease crisis, decrease emergency calls, suicide, by helping to support one another. Then with regard to confidential text services and support, that came up specifically around increasing confidentiality. Barriers they expressed was this disconnect with parents about understanding the mental health need and stigma around that, as well as this generational gap and even culture supporting or not supporting mental health. So the need for confidential text services or services in general was emphasized by youth. Then there was more mental health programs, right? We need more mental health programs, and this is heard all across the board, I think even when you're an adult, right? But through the survey, the teens identified the 5 top mental health outlets that they see being friends, that social connection, music, either listening to or creating music, sports, gaming, and the arts. So When we think about mental health programs, we don't have to think about necessarily just counseling services, right? It's just programs that help support their overall health, overall mental health, make them feel good and uplift them, right? Things they're interested in. So also coming out of this survey, some immediate community responses to what this survey is conveying. The Center for Healthcare Service Foundation approached Project Worth and the Youth Commission regarding their teen mental health first aid training, which is available to schools. They have funding for it to support that. And it is training for 10th to 12th grade students, evidence-based peer support, peer supporting peers training, right? So it gives the students the skills necessary to have supportive conversations with their friends that might come to them in crisis or just going through a mental health struggle, and also how to navigate and get them to a responsible and trusted adult to get further care and services if they need them. So Project Worth Teen Ambassadors and some of the Youth Commission members came together in August to complete this training, so the 3-day training, and they were the first cohort in San Antonio to do so. So we're very proud of that. They really enjoyed it. We got great feedback from the youth. We hope to host another cohort in the spring and also just get the word out to schools and other youth-serving organizations to help support that work, because it is a direct recommendation from the youth for that peer-to-peer support. Another community response that we got from the survey was Texas Public Radio reached out to us as well to help support a teen mental health event in the community. This was actually kind of coincidental conversation with the Youth Commission members and teen ambassadors. They wanted to host a youth event in the community, and then Texas Public Radio said, hey, we want to host a youth event in the community. And so we all partnered together. The youth were able to provide input on the activities to help support mental health. There was lots of music. There were gardening. There were youth supporting organizations in the community with regard to other areas of health. Silent disco was a fun one. There was all kinds of stuff. I mean, it was great. And so the youth got to contribute to that as well. And during that event, they also hosted a panel discussion around the Teen Mental Health Survey. Our Youth Commission dual member and Teen Ambassador Michael Valdez sat on that panel as well, along with Emerald Alanis, who is another dual member, as well as Jim Morris with Department of Human Services, and Melissa, let me find her last name, Taharina, with the VP of Children's Behavioral Health with Center for Healthcare Services. So that was with a discussion with Joey Palacios with TPR. It was a great discussion and helped get the word out about what the youth are saying. And you can access it on YouTube if you're interested. All right, so what's next? We have strong intentions and hopes to collaborate again in 2023 to put out another teen mental health survey in partnership with Department of Human Services Youth Commission members. So keep the eyes out for that, hoping to get a bigger reach. Hear from more youth about their experience and see who that is. We also want to continue to advocate and kind of encourage the community to support the needs that were expressed. As the survey shows, and as Ellen mentioned, there was an expressed need among LGBTQ+ and gender diverse youth who even pre-pandemic experienced higher rates of mental health challenges and increased health complications. And they were disproportionately impacted, as we saw, compared to their heterosexual cisgender peers. So more support for them. And then increased access and support overall, right, for mental health services. So continuing to support the peer-to-peer model, that is a huge need. So advocating for that, creating opportunities for that. And then also Project Worth, we hosted Dream SA youth engagement website to help connect youth with resources. So really pushing that out into the community. We had one-stop shop for youth to connect with resources, including mental health and emotional health resources, text lines, crisis lines, and so forth. So that is another area that we are going to be supporting. Many of you may have heard about the ARPA funding that became available in our community. So this is a recent investment the city is making in both areas of youth services and mental health. So as a result of in a response to the pandemic, so $10 million is being allocated for youth services, whereas $26 million has been allocated for mental health services, including youth mental health support. And then Metro Health, who we are with, Project Worth, our program is also part of Metro Health's SA Forward plan to expand our Teen Ambassador program. So this would create break down some barriers to access by creating a school-based program so we can get more youth involved, bringing their voice to the forefront. So partnering with middle school and high schools to do that. Incorporating an evidence-based social emotional learning curriculum to provide some enrichment and support for our teen ambassadors and just general knowledge, right? And then also incorporation of a teen health navigator to help support our teen ambassadors as they go through the program. So lastly, as you came in or as you leave, we had some resources out on the table for you all. One of which is the 150 ways to show kids you care. These are just very simple ways that we can help build the youth in our lives up. And it's a strength-based approach, right, to loving and caring for the kids in our lives. So I encourage you to take that, put it up in your office, in your room, at home, on the fridge, and just as a reminder of how we can support kids in our lives. The other resource we provided is called Let's Talk, and it focuses on social and emotional development of the youth and 5 key kind of actions we can take as caregiving adults to support them in their social and emotional development. And there's a little section down at the end where you can write in what your plan is to do that, because we all have a role to play in supporting the youth in our community. I will hand it off over to Gloria.
So the word is out, right? Mental health is important for us, for our teens, and that is great news because we know that teens who struggle with a mental health challenge or crisis are more at risk of substance abuse, dropping out, alcohol abuse. Are you agreeing with me?
No, actually my hand is up. I'm communicating with the district now, and there's, I don't know why my mic is on. There's some information I need to share with this group if you have time for me to do that. It takes about 5 minutes about children's mental health and SEISD.
Okay, so at the very end, and I'll make this quick because we'll put the spotlight on you. I'll be happy to do that. Keep it off me. I will finish up and we'll open it up to everybody and then we'll get her to share out a little bit. So, let me get my thoughts back in order. Sorry. So, yeah, the word is out, right? They're at risk. They're at higher risk of suicide, of dropping out. And the good news is it looks like we have some great recommendations of what we can do as school officials. I work at a school as adults, right? There are some terms that I thought I would mention in the next few minutes so that if you're not already familiar with, you can become familiar and then keep an eye out for them. First and foremost, I always have to promote my profession. To this day, I still get asked, what does a school social worker do? Or, so like CPS, miss? I'm like, no. I'm always looking for a quick way to explain it, so maybe it'll stick with a student and then they'll share it and the word will spread. So I usually explain it like this is, you know when life gets really messy and it's really hard to concentrate on school or work, that's what we're here to do. All that messy part, we're here to team up with you and figure it out. That involves a lot. So we do everything We are a jack of all trades, and I know there's some fellow social workers in the crowd. Every single school district in Texas has social workers. It might look different, they might support in a different sort of way, but there are school social workers at each district. The next item I wanted to discuss was restorative practices. This is picking up speed. Schools all over Texas they're taking on a mindset, a restorative practice mindset. And what I want you to take away or remember about this is the importance is placed on relationships. And the idea is that sometimes the relationship between student and teacher, student and student, admin and teacher, sometimes that relationship can be harmed because, why? I'm in survival mode, right? And so there are practices, there are activities, there is support to repair that relationship because it is through a trusted adult that can help make a student feel safe and actually heal some of the effects of trauma, right? Good news, we can heal some of the effects of trauma, which is all good news because we've all experienced a trauma now through COVID. So yay for that. So just kind of keep an eye out for restorative practices. It's not at every school, but it definitely is picking up speed, and it involves all professionals. So not just school social workers, teachers are getting trained, counselors, admins, so we can all provide a safe and peaceful space for students. The next item of business is the teen mental health first aid, and it was mentioned a little bit earlier. There's several levels of that, and so what started happening in San Antonio is because of COVID really, a lot of our educators started being trained in mental health first aid. And it wasn't for them to solve the crisis, it was to keep them safe enough until the professional could come and support them. So that's really great news. Now teachers, admins, support staff, they're equipped with skills that would bring about less harm to a student in those crisis moments.
Like first response, right?
Yes, exactly, first response, right? I love that. The other really big important one is nonprofit organizations. They've been around for years, they've been doing amazing things for years, but what I'm seeing is a trend to start bringing more and more into the schools. We have communities in schools that has been around doing great things, and they are growing every day. And they are actually on campuses. It may not be every campus just yet, but they are on campuses providing extra support to students. A safe, trusted adult, right? We also have the Children's Bereavement Center, amazing work. They have, been super flexible and made changes and started coming out to students on campus so they can provide them grief support. There's many more nonprofits. I just want y'all to keep that in mind. Big Brothers Big Sisters, Howe, the Good Samaritan Center. San Antonio has a lot that are out there to support teens, doing fun stuff, not just counseling, right? Doing yoga and all those great things outside. The next one is teen mental health mobile units. This has been maybe one of the things that has been most helpful for me as a social worker on campus. So what that is we had a group of therapists come onto our campus, and they're able to provide counseling therapy right there on campus to students. So they were removing the barriers of, I don't have transportation, I can't take off of work. They are coming to the student, meeting with them, and they're getting back to class. I don't know all the statistics on them, but I know it's growing, and I think, like I said, the word is out. So I think there's only more good things to come. So now, please take the spotlight off of me, and I will open it up to the crowd. Yes.
I'm Dr. Donnie Whiting, and I am a board member for NAMI and a board member for the Center for Heritage Services. but most important, I am a youth mental health advocate. So I have good news that Jefferson doesn't even know, and I'm in communication with SAISD. We have adopted the JROTC and the LOTC for SAISD. So we will be working with 1,000 children. I didn't know he was there. Cliff is working with me. He's also a board member. And so we are working to establish a mental health awareness and development club. And what we want these children to do, since they're already leaders, we want them to be the people on campus who we're going to train them about mental health. We're going to train them about suicide prevention and all those things that you know about. But what we want them to be able to do is, I learned a new word from the military called help seeking. And so we want them to be able to be those people on campus where if someone needs help, they can trust that cadet to talk to them. The cadet will know to get with a social worker or another adult. They are not trained to solve problems, but to take people to people who can help them. And so I want to make sure that I told you that, and we will be starting that in September. We're just waiting on a film to come through. So it's not that SAISD, they're doing a lot of things, but now we're really touching individual groups of children to train them to do what we need them to do. Thank you so much, and I'm so glad that you allowed me.
I promise I didn't pay for this, say all that. And just so you know, Jefferson High School has the best ROTC program. Okay, any questions for anyone up here?
I was wondering about on number 2 is restorative practices. I just wanted to accentuate that there's a slash there. It's restorative practices instead of punishment.
Yes. It's moving away from the punitive
There's a
mindset.
pivot there
Yeah.
that is it's evolving. It's so important.
Right, because we know suspension doesn't solve anything, right? Yeah.
So can you elaborate on what restorative practices are?
So there are, let me start with this. My spiel is relationships, right? It's through relationships a lot of magic can happen. For example, when a teacher does the work to build a relationship with the student, when that student comes in with a mental health challenge that day or in crisis, she's already built some kind of trust with that kiddo. And she's able to handle it probably a lot better than she would have if she didn't have any relationship with that student. That's one example. Another example is sometimes, we have those students that like to walk the hallways. They have a lot of energy and they need to work it out, and going to class is not their priority. And there's an administrator who in the past might be quick to say, you're out of here, you're suspended. Instead of doing that, there is a conversation. What's going on? Let's get to the bottom of this. I can send you home, but you're coming back tomorrow and you're gonna do the same thing. So tell me what's going on. If you don't wanna talk to me, maybe we get the counselor, the social worker, somebody else involved. Instead of just, what's going on with this kid? Get out of here.
Thank you.
Are peer mediation systems part of that as well?
Oh yeah,
What's
there's a lot to it. So one of the big practices that we use to be restorative is circles, right? And it's just that sitting in a circle. And sometimes that's very helpful. For example, there is a fight on campus, and what normally happens is a student is suspended, they come back and it's never talked about again, but it just doesn't go away. So let's sit down in a circle, everybody gets to say their piece, and we're gonna come to a conclusion and move forward. Yes.
I'm sorry. I'm a retired principal, so I have training on restorative practice. One thing that I may not have given her time to say was that when they are in these community circles, what we would like for campuses to do, for my campus, what we wanted them to do, we wanted them to do the checkup circles.
Yes.
We wanted to do the circle on Monday, check in. okay? Then we wanted another circle on Wednesday, this can be done through the advisory, where they just tell us how, and then again on Friday. But the Monday was the most important, because that was the one where they could share with us what they've done over the weekend that would make a difference in their lives for somebody to intervene if they need to. It's amazing that restorative discipline works. I was on a disciplinary campus, and the kids came to me simply because of self-medicating and using marijuana. But once we use these circles and establish those relationships, it made a difference. So now I'm very pleased that the schools are trying to do the circles and having the advisory period in order to do that.
Yeah, and you hit the nail on the head. It all goes back to building that relationship, and circles is a great way to do that.
It's, I know that teaching them like how to de-stress via medication instead of going to, like drugs or anything like that. Is there anybody like an expert in teaching them how to deep breathe and de-stress and help the serotonin and the oxytocin in their brain, which is a lot of that problem, especially with a lot of them that have ADHD and, et cetera, and they want to work. That's not the solution to walk it off or run it off. But it's de-stressing, just like 1, 2, 3, 4, and pause, and then out, and 4 times, and it just brings back to calm.
Yeah, and the ladies mentioned it earlier in the slide too. So one of the great things about restorative is it encompasses anything you can do to build that relationship. So, and this is just a small list of things. We have some amazing educators that are naturally doing great things with their classes. We have laughter yoga going on. We have support animals that the ladies mentioned, or peace rooms, which are calming rooms to de-escalate from a high energy situation. So please don't think this is everything. There are teachers that are out there doing great things, and it's just instinctual for them.
So like all of this right now is going on in our schools, like what you guys are talking about, like the restorative practices, the mobile units, all of that is like taking place now, or is this something that is?
It's taking place. It might not be at every campus just yet, but it is in every district. It just might look different.
Yeah.
Sorry, I have a question.
Patient.
But my question is, I've noticed that all of this is individualized towards the student, teacher. Is there anything that we are doing to include the family unit as well? Because I can understand how a kid can feel safe in the school because my teacher understands me, but when I get home, that's the reason of my et cetera. So how are we incorporating the family unit to help?
So this is why I love restorative practices. It is actually a mindset. So it is how we interact in our relationships, which means it's not just with the students, it's between staff and staff, parents and staff, parents and students. So circles, any sort of activity that is bringing in families to the school and building relationships, that's all being done, and you can consider that all restorative practice.
If I could also add, so Project Worth also has an initiative called Let's Talk that's really about family communication and bringing that into the home about how are the youth, the children even, and the parents communicating, right? So kind of to get to how do we strengthen those relationships that are already within that household.
Do you also have parents and teachers as allies, which is a NAMI-based program? Do you know about that?
I want to say yes, but I would not know the details of that.
Great, maybe the group could accentuate that as a resource that's already available and structured as in the schools to unite families.
Another, I just thought of it because of what you said. It's not on the list, but our churches around the schools, they are always very involved with our school and everything they can do It helps us form relationships. It helps our families feel connected to the community, and that has tremendous impact, right?
Are parents responding to this? Like, because I know in my experience in the past, a lot of parents are in denial of like what goes on at home behind closed doors. So are they responding well to like acknowledging that their child is going through some kind of mental crisis?
Well, maybe we ask Michael what his thoughts are about how families or parents react. What did you, from the students that you were around, what did you get the sense?
Some parents are really involved in their child's lives and talk to the children when they get home, but there's other parents that the child's not really comfortable with communicating to the parents at all sometimes, so it's a mix of both.
Okay, I'm Cliff McLaughlin. I'm a past president of NAMI San Antonio, and I'm a co-education chair with Dr. Whited. There is a NAMI program, not just, as the gentleman over there said, with NAMI as allies to the schools, but there's a NAMI program called Ending the Silence, and that's a national program where NAMI, we have like a family member with a young adult like Michael, and they present how the person maybe developed emotional problems, what kinds of things help, and talks about the family relationships and the school relationships. But that is a program that's available to your high school mental health programs. If you just call the NAMI office or talk to some of the NAMI volunteers, 734-3349, just NAMI San Antonio, and ask for Ending the Silence program. And they go out to different schools and present to high school students about signs and symptoms of emotional illness and what kinds of things can help the family and the schools identify people who might need help.
And I would imagine they present to parents too.
Yes, they do. They do present to parents. But if you call that number, a good person to talk to would be Amy Ponder, Ponder, or Annalisa Coronado. And they handle the speakers that go out to the high school districts. Dr. White, do you want to add anything to that?
No, I think you've covered it. Thank you. You've done a good job.
Oh, well, thank you, Don.
I was just wondering, you know, the youth that I work with, most of them have the 504 meetings, the ART meetings. And I was wondering about the efforts that have been made and kind of maybe the awareness in those meetings, because the families are usually, they are a part of that. So it can be utilizing that as that platform for engagement and kind of getting those families more aware and maybe meeting those needs for that family in that platform as well. I work with the Texas Juvenile Justice Department, so when our kids come out, when they're coming back into the community, those ART and 504 meetings have been vital to ensure that that is being addressed, and then also to kind of give suggestions of the work we've done with the family and how that can kind of be continued, because you don't stay with them forever. However, they do have a lot more years with the school systems and then the community, you know, community healthcare systems as well. So I just wanted to know about your efforts and
Yeah, I think communication of everything going on can always improve, right? But I think the idea is children are going to be funneled to a counselor, to a social worker, to an admin who's aware of everything that's going on campus, and we would get them connected. I had an idea when you were talking, maybe in those meetings, we should be doing some kind of flyer or referral right then and there. We also have family and community engagement specialists at our campuses, and their job is to be the the middleman between families and the schools. So they give out a lot of that information as well.
So I'm actually gonna stop us a couple minutes early so that we can turn over the room. Can you go back to the slide that has the code on it for the survey results, just because I know that some people, y'all can walk around and come take a picture. If you have questions, again, I think the sessions are kind of back to back, so I wanted to give us time to turn the room over. But please feel free, I'm volunteering these experts in their field to come and field your questions if you have more. I just want to thank all of you so much for being dedicated to youth mental health. I think all of us are activists and want to be advocates for our folks and for the young people in our community. So thank you so much.